is Dr. Bob and Debbie DeMaria with some healthy information for you. Today, what I'd like to talk about is how significant and how important the spine and nervous system is for optimal health in your body. I've been practicing since 1978, and we have seen miracles. Every day we see miracles in our practice, and it's always so exciting to have somebody come into the office and have a challenge that they really have been suffering with for years, do an assessment to them, and help restore function. I want to talk to you today about basics, how your body functions. Your brain sits in the skull. It continues on inside of this bony column. It's called the spinal column, that's made up of 24 vertebrae that move. We know that the nervous system is very important because it's encased in bone. Now I'm going to share a thought with you. Your body has the ability to heal itself. Your brain literally sends out 28 billion messages every day. You probably never think about the fact if you cut your finger, it heals. You know, it has been said that we can live up to a month, maybe even 2 months without food, days without water, minutes without air. But you know what? You can't live but a millisecond without your brain sending that healing life force throughout your entire body. I have this very significant poster for you to look at right now. It's about life and life healing and how your brain sends the messages down. If you look really close right here, the information is going down and the nerve that's represented here is functioning normally. But this particular vertebra has gone out of alignment and is putting pressure on sensitive nerves, interfering with your body's ability to heal itself. In natural drugless chiropractic, we call that a subluxation. A subluxation is when a bone literally goes out of alignment and puts pressure on a sensitive nerve. It is not uncommon for me to have patients come into our office who have been suffering literally for years with chronic sinus challenges. We complete the assessment, which includes films. We locate the misalignment, which for the example of the sinuses is commonly this second cervical vertebra. We correct that alignment or that misalignment with something called an adjustment. Adjustments are painless ways to put the vertebra back into proper position, literally on choking the nerve so the body has the ability to heal itself. What I'm holding in my hand right now is an enlarged version of the two top vertebrae in your spine. This top vertebra is called the atlas, and they're condyles from your skull that rest here. So twisting occurs at the top vertebra and the one below it. And if you look close here, this is almost like the stem that you would see on a semi-truck when it's driving. So these vertebrae move back and forth. But what happens is Debbie's going to help me with this. If you could pull that apart. The spinal cord goes inside of this hole all the way down your body. So if you have misalignment, thank you, Deb, if you have misalignment and your head is tilted off, like and as I'm looking at you right now, my head is angling off to my left, I know the upper part of my spine is not functioning optimally. Now this is going to be really important for you. If you've ever had a hose coming off of your house, a water hose, and if you clamp the hose right where the water is leaving the house, no water is going to go to the flowers or the grass that you're watering. In your body, if you have misalignment right up here in your upper neck area, it's called the atlas and the axis. If you have misalignment there, it literally could impair function to your entire body. And I know that Debbie and I, since we've been practicing since 1978, we've literally seen miracles in our office constantly.
Constantly. And the thing is that sometimes you do not realize that you have a subluxation till years afterwards, Dr. Bob, because you could have a subluxation from birth and have all the typical childhood ailments and not realize that it was something that occurred at birth. And if you would have been relieved with your subluxation, you would have lived a symptom-free life.
You know, I'm glad you brought that up, because see, what causes subluxation? So the term is subluxation, S-U-B-L-U-X-A-T-I-O-N. A subluxation is when a vertebra goes out of alignment and it compresses sensitive nerves. What can cause a subluxation, number one, is a traumatic birth, including C-sections. See, a cesarean section is actually traumatic. Our bodies are designed to go through the birth canal. There's important steps that have to happen for that child's neck to get strong enough to be out and be involved with gravity. Motor vehicle accidents, slips, falls, when you learn how to ride your bike, falling off the back steps, sports injuries, especially soccer, football, and we have kids that are playing soccer almost too young of an age and they're hitting their heads, causing neck trauma. So trauma, injuries, and I have had patients come into my office. I had one yesterday that came into the office and she had an injury way back in the 1970s, and she looked at me, she said, "You mean that can cause my problem, Dr. Bob?" And oftentimes I'll point to my right knee and say, you know, when I was a child I fell down on a piece of a toy called an erector set and I cut my leg. Well, that was many, many, many years ago. Well, the scar is still there. Your body never forgets. So if you've had any type of trauma or injury that's occurred to your spine or your nervous system, you may be living with conditions today that are directly related to trauma. So if you're watching us here locally, you might want to come into the office. If you're watching us in our office or online, this is very serious. You need to follow the recommendations that are based on your findings. And over time, as we correct and improve the alignment in your spine, you're going to not only have a pain-free life, but the overall symptoms and the overall health of your body will improve, including chronic sinus and digestive problems and menstrual cramps and constipation. Chiropractic is a wonderful, drugless, natural way to stay healthy every day. One last thought. Does gravity ever take a vacation? We'll be right back. Hello, this is Dr. Bob and Debbie DeMaria with some more healthy living information for you. The spine is awesome. I just love talking and learning about spinal function, but you know what gives me more joy than anything else is helping you wrap your brain around how your body really functions. This is probably one of the most significant posters I've ever seen in my professional life. This is an example of how your spine works. And when I have patients come into the office and they see this, it's almost like the light bulb literally goes off in their head. Your spine is a set of circuits. And if you have children at home right now, I think it'd be really interesting for you to take them to the circuit panel when the program is over and show them when the switch goes off, it affects the appliances and the lights in your house. Well, what also significant is if you have misalignment in your spine, you may have a child at home that's chronic asthma, or you yourself may have chronic digestive distress. You know the #1 medication that people take in the planet is a digestive aid. And so I know that you could have misalignment to the mid part of your spine that affects the nerves that go to your stomach, just as there could be misalignment in your spine to the nerves that go to your colon. Or for females, you may have menstrual discomfort. And for men, you may have some issues with erectile dysfunction. Now, what I'm going to show you now is so significant. Our bodies work by electricity. The brain is constantly sending information. We work by electric. Inside of this ball, there's a computer with 2 batteries. And what I'm going to do for you right now is just simply show you a little exercise that we show our patients, and maybe you've experienced this in our office. here's a ball, and I'm going to touch this little right here with my finger, and you can hear music. Now watch, and I'm going to let go. Now, what's going on is I'm completing a circuit. So it goes along with that circuit panel that I just showed you. Now this is also really interesting because, see, our spinal vertebrae are very much like these circuits. Now, the very most important organ in the body, and there are very many important, actually, do you know that the spine and nervous system is so important? The question is, what was the very first organ in your body to be created? Most people will say the heart. Well, not that I want to correct you, but you're wrong. It's the nervous system, because the nervous system has to have the wires that literally go to the heart. So if you have misalignment in the upper part of your spine, like this, and the click is off, you could have literally heart palpitations occurring in your body because of misalignment going to your heart. And we've had many patients with chronic heart conditions, and we have other nutritional assessments. One of them is called the acoustic cardiogram, that we can listen to your heart sounds and create and recreate diet and nutrition along with your spine and the nervous system. Do you know that there are 45 million prescriptions given to kids every year for asthma alone? So the vertebra from your upper back go to your lungs. And finally, one that is the most common for adults is misalignment in your spine that affects your colon. So you could have chronic digestive distress because of misalignment in your spine that's impairing function. What I'd like you to do is look at this miniature poster that I have right here. Here's the brain. The brain sends out 28 billion messages every day. So if the power is shut off, and let's just say for this example, going to your stomach, and you go to your conventional medical practitioner, what they're going to more than likely give you is a product, a drug by the way, which is going to manage symptoms. If you ever listen to the advertisements, which are almost ludicrous in my opinion and observation, that they're managing symptoms, and if you ever listen to the very quiet bad effects, my gosh, you probably would die from the bad effects of the medications that they're giving to you. And I'm not telling anybody to go off their medications. That's not the purpose of this. I'm just trying to expand your thinking, because I've had patients come into office taking anywhere from 3 to 15 different medications every day. Do you know that one medication has 10 bad effects? 2 medications have 100, 3, 1,000, 4, 10,000, 5, 100,000, 6, 1 million, 7, 10 million, 8, 100 million. If you're taking 9 medications, which is not uncommon today, you're having over 1 billion reactions in your body every day. Finally, I know that so many of you understand that Dr. Bob talks about food a lot when it comes to health. Well, here's what you need to also understand. What you eat, especially sugar, can refer pain and misalignment to your spine. There's a big word I want to give to you right now, but this is very significant. It's called visceral somatic subluxation. A visceral somatic subluxation is when a bone or a vertebra will go out of alignment directly caused by you eating something that's going to aggravate the nervous system, that's impairing the function of the vertebra that are sending the messages to the rest of your body. That was an awesome little biology class, wasn't it?
It was a great class, but what I think that we should point out, Dr. Bob, is on your poster, many of you didn't take the time to probably look that the red lines coming out of the spinal column, which was, of course, your switches, those were functioning properly, but there was actually 2 that those red lines weren't red, they were black. And that's exactly what Dr. Bob is trying to explain to you, is that there is no life source, no energy source coming from that switch to the rest of the body. So it is misfunctioning, and the only way, because you don't want to take drugs for that, because drugs only masks the symptoms. It never takes them away. But the only way to get to the root cause is to find chiropractic care to eliminate subluxation.
So it is very important for you to understand the purpose of the adjustment is to take away the misalignment that allows your nervous system to function properly. And when your nervous system is functioning properly, the organs and tissues in your body will work at 100%. Gravity, remember, never takes a vacation. That's why it's so significant for you to follow the recommendations, do your traction, make sure you're doing your exercise, and if you ever have a question about exactly how your care, once you wisely make that decision to come into the office, or if you're already a patient in our office, to follow through. If you have any questions, myself and our team are here to make a difference for your life. Thank you. Hello, this is Dr. Bob and Debbie DeMaria, once again teaching you some healthy information. We've been talking about how the spine and the nervous system function. You may say, well,